Male health, or more specifically male sexual and reproductive health, is still one of those topics that can clear out a room of Irish men faster than the promise of a free pint next door. Unless it's in the context of a dirty joke, we just don't like to talk about things like hormones, self-examination, impaired function, performance issues, and all of the other things surrounding this subject. The sad fact is that this reluctance to acknowledge and discuss these things leads to a stigma and an embarrassment, and it often means that men don't get checked out regularly and don't seek help early when something is in need of attention. Somehow, going to the doctor when you've got the flu is no problem, but admitting that you need assistance with a reproductive or genital issue means that you're less of a man, whatever that means. In this particular podcast episode, which is part of a series that we're going to do on male health, the topic of discussion is circumcision. Circumcision is a surgical procedure where part of the foreskin is removed in males. The procedure is done for a wide variety of reasons depending on the cultural context of where you happen to come from, religious beliefs and so forth. But the main reason for circumcision is generally to treat some form of physical or medical dysfunction of the male genitalia. Today, myself and Dr. Sam are joined by Dr.Ernu de Villiers from Namibia in Southwest Africa. Dr. de Villiers is hugely experienced in the field of male health, and particularly in circumcision. And between himself and Dr. Sam, they share literally thousands and thousands of successfully performed operations, transforming the lives of many boys and men with this relatively simple intervention. In this podcast, we discuss the relevance and importance of these types of procedures, from disease prevention and control of STDs to reproductive and even aesthetic concerns. Like anything that affects how happy you are, how well you are, and your quality of life, this type of topic is important to understand, to acknowledge, and to accept. The terminology used in this conversation might sound crude to some people, but these are words and terms for completely normal things. And to attach shame, stigma, or embarrassment to these topics does a huge disservice to the massive number of people across the planet who suffer on a daily basis with conditions that they're too afraid to talk about or too afraid to research. So a healthy dose of maturity is needed when you're listening to this chat. Enjoy the podcast, and if you want to learn more about anything we discuss, please just get in touch. This is a podcast about finding answers to human questions, taking control, and feeling good. This is the Human Regeneration Project. Okay, welcome back to the podcast. Today we are starting a series on male health specifically, and I'm joined today by Dr. Sam van Eeden, a familiar guest on the podcast, and we also have all the way from Namibia Dr.Ernu de Villiers.
Hi, Dan.
Just a little disclaimer before we get into this topic. Obviously in Ireland this is something that might be seen as a little bit taboo or a little bit sensitive. A lot of the phrases and the terms that we use today for educational purposes will be very descriptive and not graphic is the wrong word, but this is specifically so we can discuss these topics properly. This is in no way intended to be crude or disrespectful, but it's very important that we can actually openly discuss this topic. So before we get started here, I'm just going to ask Dr. Ernu to give us a little bit of an introduction for people who might not be familiar with yourself, where you came from obviously, and why you're here today to discuss this topic with us.
Well, Dan, thank you very much for the initial introduction. I'm a general practitioner from Namibia. I have a special interest in functional medicine and regenerative type medicine. It's a little bit different than in European countries where general practitioners are seen as specialists in general medicine. In Namibia, a general practitioner is a doctor that when graduating medical school is allowed to practice general medicine, including surgery.
So you do a little bit of everything as
a little bit of everything.
I suppose also that it's the distance issue. You know, I mean, you're sitting with people perhaps in small towns that's possibly 400, 500 kilometers from the next town.
Yeah.
And you have to do that surgery. You have to do that basic surgery, sometimes life-saving surgery in your local hospital. And it's very different from here where you can get in a car and just drive off to Beaumont.
Yeah, the distances from Windhoek, which is the capital, to the coast is about 380 kilometers.
Wow, okay.
And from from Windhoek to Cape Town, which is probably the nearest academic center, is about 1,600 kilometers.
Wow.
So in the past, we would have visiting specialists with general practitioners doing most of the work and waiting for a specialist to come in, do what they do, and then leave with the special or the general practitioners left behind to look after the patients again.
Okay. So obviously, with your background now with general medicine, as you've explained in South Africa, from a male health point of view, is this something that you specifically decided, or was it the demands of the area meant that you had to step in and fill this gap?
Well, I think it's such an integral part of one's practice that you can't really step away from it. Having a special interest in surgery obviously helps a little bit in terms of the surgery side of male health, which is something we'll touch on a little bit later with the male circumcisions.
Absolutely. Okay. So for today's podcast, I think we're going to have a look specifically at these surgeries, and circumcisions are the number one surgery when you think of male health and male procedures, I suppose. Dr. Sam, this is a huge part of your practice here, specifically in Ireland. So why would you just give us a brief explanation for people who aren't really familiar or who may not have researched this topic? It can be a little bit confusing. There is a little bit of a mystique around it for people because they don't want to think about it or talk about it. Would you just give us a kind of a synopsis of what is a circumcision and what's the purpose of this procedure?
Right. So important to say, it is one of those no-go topics in a pub, in a family, even within very close friends, that males often run into trouble having an issue and just do not have the courage to talk about it, because culturally it's not really something that particularly in the Irish culture, but in all other cultures as well, there would be a bit of a reluctance to talk about your penis and talk about your problem that you have. So many a time these guys end up on the internet. And this is not something that I can put up on, for instance, our webpage or really advertise, which is not allowed anyway, but it is a topic that is actually very difficult to research. And most of the clients that I see would first thing tell me, thank you very much for having access at least to some information on the Circumcision Dublin Ireland website. But because we can't find anything that is, first of all, trustworthy, and secondly, that is ethical. So it is a very difficult topic for the guy sitting there 9 o'clock in the evening, 10 o'clock, and having an issue and wanting to address it. But where do you find the information? So that is a difficult topic. And it is not something that is out front, even in my clinic. It is word of mouth most of the time. There's a number of blogs I know boards.ie has quite a lot on that topic going as well. So I suppose in the end, I must say in Ireland, it is a situation that all males will avoid at all cost to go for a circumcision. So who are the males that we mainly see in Ireland, in my practice at least? Are males who are running into developing a medical condition. And 99% it is a tight foreskin, or called phimosis. Some of them has it a combination with not only a tight foreskin, that means they can't retract the foreskin even when it's flaccid, and particularly not able to pull it back when it's erect. But also many of them present with a second problem, and these two things often go hand in hand, and that is a frenulum breve, or a very short frenulum. That's that little banjo string that touch the ring, the inner foreskin ring, with the glans, and the implant is just under the opening where the urine comes in. And so often you find males running into trouble during intercourse, that little frenulum rips and causing scarring, and it is just a mess, and it is just from there on one big nightmare. And so a lot of my patients would come only because they kind of have no other choice. In my practice, I don't know about you, Anu, but very few males would come into me say, oh, I'm coming here for cosmetic reasons. I just like to be the circumcision appearance. Very few would do that. Secondly, very few will also say, oh, my wife wants me to be circumcised. You know, she prefers that appearance. Very few of them. So who are the others coming in? They nearly all have a problem with either phimosis or BXO, or a frenulum that's not working, or just penile dysfunction as the result of foreskin issues or skin issues on the penis itself.
What's BXO you mentioned there?
So B stands for balanitis, X is for xerotica, and O is for obliterans. So when a male presents with balanitis, it's a chronic itch and irritation, and they often touch themselves all the time, and the wife or the girlfriend would say, "What you doing there?" So they must look out for that chronic itch. It is a chronic low-grade inflammation or infection under the foreskin, irritating the glands. That's balanitis. And xerotica is actually a change in the color of the skin. And interesting enough, a lot of guys that eventually come for help is alarmed by this sudden loss of the color of their skin. The shaft might be a bit of a brownish color typically, and suddenly they realize but the tip has lost its color and it's become more white or pink. So there's a big contrast between the color of the tip of this foreskin and the shaft, and that alerts them. So they come in. That's xerotica. The O is the Latin for obliterans, obliterating or closing up. So what they found over a period of time that this obliterating tightness just increases, gets more and more. Eventually they can't pull it back, can't clean anymore, and eventually it starts to affect even the way how they urinate, and start spreading, and they have to sit and pee because they can't actually stand anymore. It's washing the bathroom floor if they try to do that, So eventually the penis becomes more and more dysfunctional. So what is very important about BXO, it is seen and it described in the academic circles and within clinical practice as a pre-runner for Kaposi sarcoma or penile cancer. So these things are serious stuff.
Okay.
It is not something that people would present and not knowing what it is. But unfortunately, by the time they reach me, they're absolutely shocked.
Yeah.
Then to find that this is possible, of course, we do the circumcision and we will send it away for histology. And if it is confirming BXO, there is an alertness about this. And it's unfortunately, there's very little awareness in young males. And this is something that you can see in your 20s. It's more often in older males, right? So if you have a normal, healthy working foreskin and suddenly it starts dysfunctioning, and especially if there's a change in color, that's the red lights flashing, guys. Don't put the head in the sand.
Yeah.
Seek help. Come and see me. Come and see any urologist. To go and see your GP even, and that is not normal.
I think this is a good point because most people traditionally in this country anyway, their only experience with circumcision is from movies or jokes that would have heard, and they would think mainly it's for either cosmetic or religious reasons. But obviously you've just explained there are many, many different medical reasons why this would be done. Is that similar in your experience now, Dr. Ernu, from Namibia?
That's a very interesting point that you're making there, because in Namibia we actually have a national drive for a voluntary male circumcision program, which started in about 2005, 2006, and promoted by the WHO. So what we see is we very, very seldom see pathology, because it's traditionally or accepted that men, when they are young, are circumcised for a couple of reasons. Cosmetics not being one of them, really. Mostly prevention of sexually transmitted disease. It's been shown that there's a reduction of 50% of HIV transmission in circumcised men, which is quite dramatic. And we know that because of the change of the mucosa of the glands of the penis, your risk for contracting human papillomavirus is dramatically reduced. So your risk for developing issues due to that later on, and transmission to women, which we know also that they develop sin lesions, or which are abnormal, superficial
pre-runners of cervical cancer.
Of cervical cancer. The transmission rate is reduced from men to women, so we get a reduction in women developing presenting with cervical cancer.
That's fascinating, and I didn't realize. But Africa, the average for the whole of Africa, including sub-Saharan, would be 46% of males would be circumcised.
It's actually a little bit higher. Studies show up to 62%. So South Africa is
Amazing.
about 47%
Yeah.
reduction. The initial drive for the VMMC campaign in Namibia was actually to try and circumcise all sexually active males in around 2022, if I'm not mistaken. I know the numbers indicate around about 2006 they circumcised about 1,200 men. In 2016 they've already done about 22,000 men, which is it doesn't sound like a lot, but in a population of about 2.8 million people, it's quite a lot. The drive is to circumcise young men from early when they become sexually active. So from about 11, 12 years. Which is obviously we don't promote sexual activity from that age, but they actually do target young gentlemen from
generation.
that age.
And it's interesting now that I think about it, in the UK, we know the official figure is only about 7% of males would be circumcised in the UK. From my own experience doing this now for about 10, 12, 13 years now in Ireland, actively running a circumcision practice. It is, I suspect, around rather 5% of Irish males would be circumcised.
That's incredible.
And it's interesting that I actually see the pathology,
Yeah.
and you in your place would not really have that kind of pathology.
We don't.
Yeah.
Winter holidays is a typical time. The mom would come in with 2 or 3 kids and say, "Listen, it's now time.
Yeah.
Dad's getting circumcised because he's going to be part of this process just to motivate the boys, and then it's." All the brothers are standing in line to get circumcised.
Talk about families and fathers. Interesting that in the US it was usually very popular, and they would have reckoned that about 60% of males would be circumcised in the year 2000, and it actually by 2009 has dropped to 54%. Right, but they did a study on this to see why there was such a steep decline. Especially in the rates of newborns. It dropped from 56% to 30% in newborns. But the primary reason for that, if daddy was circumcised, it was such a strong motivation for mommy to decide, well, the boys need to have a circumcision as well,
And these newborn circumcisions, are they doing these newborn circumcisions specifically because they have these statistics on prevention of disease? Correct. Or that's right in the US, it's not religious reasons or anything else like that?
Yeah, correct, yeah. So the infant circumcision is a personal decision, we know that. But the American Academy of Pediatrics released an official statement after a very prominent study a few years ago. And it found that circumcision actually does reduce the rate of some types of penile cancer, including the BXO, which I often see here. And that in overall, the benefits of a circumcision does outweigh the actual risk of the circumcision. But ultimately, they concluded that they can't make it a routine procedure, and it's still a personal decision for parents. So in that way, we encourage, like in Namibia, for this actually circumcision to be done. Parents is motivated to do it based on studies like this, right? But to have it actually routinely done, that evidence still lacks. And that's why it's not done routinely.
It's interesting. It's very much part of the certain groups of our culture in Namibia. And we know that from the medical insurance or medical aid side, they do not want to cover those circumcisions. So in the past, you would have traditional circumcisions, a huge numbers of circumcisions being done at a time. Like in South Africa, we all know that the Xhosas, as part of their manhood or transgression transformation
into adulthood,
is a circumcision with
physical sign,
without any. It's a pure. The skin's just cut off. There's no surgical closure of the wound afterwards. They go sit down
often in a shack or somewhere.
There must be massive rates of infection and things like that.
They do,
and deaths, unfortunately.
In Namibia, we don't see that. It's not the pressure between brackets from the medical aids to not cover those those procedures for babies, unless there's a medical indication, as I would think reduced the number of circumcisions done. But we do find that as soon as a gentleman is becoming sexually active, as a motivation on the letter to the insurance, we write there circumcision as part of the Namibian circumcision campaign. They do actually cover those procedures from the age of about 11
because they can see it as the disease prevention drive then.
Yeah, and just even for that approach in Ireland, because a lot of when I was still in general practice, parents would ask me when I come for the 6-week examination, what do you think, is it necessary for to be circumcised, and the answer is straightforward. In the end, it's a personal decision. But cultural talk about that, in Europe, there's a very strong drive to see this as an illegal act. But this is something the child need to decide on when he's becoming an adult, and parents are extremely reluctant, even as a 3 or 4-year-old coming in and they have an infection of the foreskin because they can't retract it, and we're going to talk about that now. They very reluctant, even for me saying, I better refer you now to a pediatric surgeon. We need to consider circumcision. It is like telling them you're going to cut it off.
Yeah, I'm glad you mentioned that, because there's a huge red flag that I see all across the internet and the forums, and people get really worked up about this. You've mentioned several times this is a personal decision. Yeah. But how is a brand new baby supposed to make this decision for themselves? Now, if there's real hard data there that this could really prevent disease, then it makes sense.
I think what they based it on in the American Academy for Pediatrics was based on the fact that it is not essential for the well-being for the baby to have it done. And I think on that basis, they couldn't justify to make it routine, but that there are health benefits. And especially, let's be a spade is a spade. We live in a very promiscuous environment where youngsters, 13, 14, 15, that I've treated for STIs, that's it. We need to face the reality. We have now a HPV campaigns for young teenager females well established in Ireland. There's for young males are now launched as well. So we're injecting our children because we know they are very sexually active at a very young age. So reality is, if you look back now at the statistics that Ernu also mentioned there, how a circumcision as a child can actually prevent a lot of these diseases, including the HPV virus.
Yeah, transmission.
We might be rolling back the clock here, and one day say to each other, it is now so reached so much high numbers of the prevalence of HPV related diseases. And by the way, BXO is one of them that we would think, where's BXO coming from? Why do people start at the age of 27 presenting with BXO? HPV.
Okay.
Right. So they do even stains. Now, when I send the foreskin away for analysis, I always would request, especially when I ask the STI, when did they start getting sexually active? If they tell me 14, 13, 15, I always ask for HPV stain.
Okay.
And most of the time it actually comes back, HPV.
It's quite interesting. You said that they send away the foreskins for the HPV, that there are so many different strains of applicable to this, that we have a high risk strains and we have lower risk strains of HPV, and we know that I think strains 11, 16 and 18 are typically high risk for women in the future to develop cervical cancer, which is a transmission. It's transmitted to them via sexual intercourse.
Yeah, and absolutely. I don't want to let it sound that we're encouraging circumcisions at all. I just want to make this very clear that it is a personal decision, and I would much rather prefer that young man to make his own decision than me saying that it's better to have it done. I'm not saying that. I say the statistics is very clear that because of the prevalence of HPV in our younger generation, because they are more promiscuous, unfortunately, but also that's are the facts of the reality. Culturally, it's become just more acceptable to have a sexual relationship at a very young age. Now, in the end, when we look at the bigger picture here, we want to have healthy young men and healthy young females. So bringing in campaigns like that is absolutely critical, that people do partake. And as always with medicine, there are complications for some. But if you ask my personal opinion on the HPV vaccination campaigns, I think they're very important, and parents should consider all the options, including not doing anything, but also including and not excluding looking at HPV vaccinations, because I see it in clinical practice as BXO. That's how it presents.
Yeah.
It's seen in clinical practice as an escalation in cervical cancer. So we can't be blind to the actual facts that we're talking here about, you know. Interesting enough, just for in Europe, it is not popular at all. Hence also the resistance to have baby circumcisions. Less than 7% to 10% would be circumcised in Europe. It's very unpopular.
Wow.
Mostly. And
what's the main resistance to it in Europe?
I think it is the whole concept of naturalism and just leaving the decision to the child, which has been pressed very hard, human rights point of view.
Yeah, the one I've heard is it is an assault.
Absolutely.
Yeah.
It's seen as an assault in many countries.
Yeah.
And the only two countries that you would see quite a high rate of 80% of circumcision within Europe is Turkey and Azerbaijan.
Really? Okay.
Which are mainly Muslim-based, so it's obviously for religious reasons, not because parents have a choice to really do that. You know.
Yeah. I personally try to avoid baby circumcisions.
Okay.
The risk outweighs the benefit, and it's very easy if a mother comes in with a baby and there's no pathology. Look, if there's pathology, risk-benefit ratio it's always applicable. But if there's no pathology, I would very easily say to the mom, if this was my child, I would seriously consider the risks above the benefits of circumcising. When this child becomes sexually active, yes, for sure. And in Namibia, it's promoted very much. The VMMC programs are very much in your face. There are posters all over the show where they would really promote voluntary male circumcisions. And it's spoken about between men.
And there's not a single word in Ireland.
No.
Yeah.
Well, I'm glad you mentioned the risk-benefit ratio. So just to bring balance to this discussion as well, and for education, the risks. Let's talk about risks for a second, because obviously we know there are a lot of benefits for a lot of different reasons, and a lot of different reasons these procedures are done. But it's a surgical procedure, and whether you are a newborn baby or a 65-year-old man, surgical procedures carry risks, and this is a particularly sensitive area. And especially when you're dealing with removing tissue, potentially infectious tissue or disease tissue, there is risk involved in this. Would you, Dr. Ernu, just mind talking us through some of the potential risks, not to frighten people, but more to educate?
Well, like I said, when you circumcise, let's start with babies. When you circumcise a baby is circumcised under general anesthesia.
Okay.
So that's your first risk.
Yeah.
Putting a child to sleep for a surgical procedure has all the risks involved, as you would expect. Then, in my practice, 99% of my circumcisions, unless this individual has a needle or a phobia or theatre phobia, it would be done under a local anesthesia, which reduces the risk in terms of anesthesia, obviously, dramatically. So as like you said, with all surgery, there's a risk. There's a risk of, and probably the most important risk would be what the patient expects as the outcome is not with what is provided.
Yeah.
But as we know, surgery risks pain with the initial injection of the anesthesia, bleeding with the procedure, scarring afterwards, potential risk of infection. Post-procedure, changes in sensation post-procedure, and then obviously the cosmetic part of the aesthetics part of it. What does it look like afterwards? Is this result that you're achieving acceptable for this individual?
Okay. Sorry, go ahead, Dr. Sam.
Yeah, and I suppose where you practice there as well, there is a very high risk or increased risk of actual infections in the living socioeconomic circumstances of that.
Well, Namibia is not so far behind as you would expect. If I would compare it to Europe, Namibia specific, our level of healthcare is quite high.
Yeah.
My facility has a.
But I mean, as the person's going home.
Well, that's a difficult
Because we
situation.
just
Obviously,
thinking, the other day you mentioned you give your patients a standard
as
antibiotic discharge.
which is it's not always acceptable,
Yeah.
even in Namibia. Very
Yeah.
often post-surgery antibiotics not expected
Yeah.
to be given. But you have to understand that some of those patients go back to a tin shack
Exactly.
with a sand floor.
Yeah.
And there's not always the available general hygiene is not always available.
Yeah.
They don't have running water.
Mm.
You can imagine if you've had an operation and you need to clean a wound and you don't have running water, if you don't have a proper sewage system, it does increase the risk of infection. Most definitely.
So we're very fortunate. Like, I would never give an antibiotic to any of my patients ever, except if they are diabetic or have a risk of possible skin infections, which they always will declare to me on my questioning them. It was just interesting to me when we had.
Well, it's once again, it's the risk-benefit ratio.
Yeah.
You only need to see one individual with a post-circumcision infection, and you are cured for the rest of your life as a physician.
Okay. You never want to see it
You
again.
don't want to see it again.
Yeah.
And we, as a matter of fact, I see my patients 1 day post-surgery, 1 week post-surgery, and they have access to the facility at any time. In case they have an issue.
How common are these risks? You mentioned infection and things like that. Are these common enough for people to be really concerned about it, or are they relatively low?
They're relatively low.
Very
Risks
low.
are always there. They're very rare.
Okay.
Right. For a few reasons. Number one, the way the surgery is executed, most responsible surgeons will make sure that they have good hemostasis, or stopping of all blood on the field of the operation before you close the skin.
Yeah.
And both of us are using radiofrequency and special tooling to actually make sure that there is proper bleeding control there. But secondly, also, remember, the penis has an incredible design when it comes to antivirus, antibacterial, antifungal infections. So the smegma that's produced by the glands under the foreskin are particularly targeting those pathogens.
Okay.
So you have a great help from your own body controlling infections.
Yeah.
So again, infection, although we have to mention it, usually would be induced an exogenous factor. In other words, poor hygiene, it's standard, etc. But seldom from the wound or from the penis itself. It is designed to be able to withstand
Very resilient organ.
very resilient area.
Good to know.
Yeah, right. And the third thing is bruising and swelling that you get with any surgery.
Yeah.
So that you will always see in most patients we're getting a circumcision. But the first two, bleeding and infection, are actually rare.
Okay.
And I always say to my patient, you might develop this. It's my duty to tell you. You might get this, but it's very unlikely.
Okay.
And I think that is the concept for most
I think we
people.
put in so much time and effort to prevent complications that by itself makes it very, very rare. You really spend time to look at every little blood vessel, try and catch them, make sure that it doesn't bleed afterwards.
Yeah. So what I want to say about the smegma, which is the discharge you find naturally under the foreskin, that is a very important part of development, which is also part of a very important part why people would come in my practice, and I'm sure Ernu would see the same in his practice, and it's developing a tight foreskin, which is the number one reason for people presenting in my clinic, at least.
Is this the phimosis you mentioned?
The phimosis, yeah,
Okay.
yeah. So let's just quickly run over that and just realize that in Ireland particularly, and I'm just talking for this country, that's where I practice at the moment, there is very little education for parents how to manage the foreskin of a newborn baby boy or even an infant. And it's just not talked about. It's not. Parents are not educated about that. Parents don't talk about it, so children don't talk about it. The reality is then, when you look at the real anatomy of the glands around the age of 18 months, starting to produce the smegma or the oil, up till that stage, the foreskin and the glands is actually attached, right, by a very thin fibrin layer, and it's actually one layer. But around the age of 18 months, the glands becomes active and it produces this oil, And this oil is forced in between these two layers, and the oil starts to separate the foreskin from the glands. But then you have to manually start pushing that skin back. And what is very important, that you have a very short window of opportunity to make sure that that foreskin is going to be functional as an adult man. And that window is only between about 18 months and 3 years of age.
Okay.
Ideally, when you have an infant that is around 2 years old, you already want that foreskin to be pushed back. So every night when you wash the boy with just water on the penis, you have to literally push the foreskin back, hold it in that position, stretch that little opening. They wriggle a bit, it's uncomfortable for them, but for that 30 seconds, you should hold it there back and then release it. Tomorrow night, you do exactly the same. Every night, you push it further and further. It takes about 6 to 9 months for the foreskin to completely slide back. Every night, you will see it actually goes a little bit further, and eventually, around 2 years of age, the foreskin should be completely folding behind the corona or the crown of the glands. Why is that so important? Because when we start potty training of the 2-year-old, you need to teach him to actually fully expose the glands while he's urinating. So that is another important process, physiological process that comes to play, is that when you urinate and you expose the glands to the oxygen acts as a very powerful sterilizing action to actually kill all pathogens that shouldn't be under that foreskin. So it is part of a sterility procedure. And imagine this now, 4 or 5 times a day you go for a pee, and 4 or 5 times a day you by exposing for 2-3 minutes, you have about 10 to 15 minutes of exposure to oxygen every day. That keeps your foreskin healthy, keeps the glands clean, and reduce the effectiveness of the possibility for infections, right? And especially when you're married or when you have a permanent sexual partner, reduce the risk for transferring infections. Just that simple measure of exposing. The foreskin was never designed to pee through. It's anyway a mess when you try to do that, and shouldn't really be encouraged to be done, you know. But again, it's education. That's why this podcast is all about.
Hi guys, in this episode I'm joined by Dr. Sam van Eeden and Dr.Ernu de Villiers to discuss male health and more specifically circumcision procedures. If you'd like to learn more about anything we discuss in today's podcast, you can contact us at info@humanregenerationproject.com. To get in touch with Dr. Sam's male health clinic, you can email info@circumcisiondublinIreland.com or visit www.circumcisiondublinIreland.com. You can contact Dr. Ernu de Villiers at ernu, E-R-N-U, at afol.com.na or visit his website on www.namibia-aesthetics.com. Well, here's where we've hit our major flaw culturally in this country anyway, because I've seen you explain this to young parents, and it's an incredibly uncomfortable conversation because they start to can't look you in the eye. If you mention this to people on the street, because of the religious connotations in this country and the what's the word I'm looking for here? We're quite sheepish when we're talking about anything to do with sexual health or sexual relations or anything like that. If you're telling a young parent, to male or female, that they have to retract their son's foreskin every evening, they're just not going to do it. They're going to say, yes, doctor, and they're going to go home and don't even talk to each other about it. That seems to be the majority of cases in this country. And what you're explaining is that could be a direct preventative procedure for your child.
Absolutely, because the reality is that between 18 months and 3 years of age, the penis doubles in size. Between 3 and 6, it doubles again. Between 6 and 9, it doubles again.
Okay.
Between 9 and 19, it triples in size. So can you imagine, by 3 years of age, that you can't pull it back? How impossible it becomes to do it at 6, 9, or 19.
Yeah.
So no wonder this is something that's pushed into adulthood to be dealt with by the poor guy who basically finds out on the first night out with a girlfriend, and she might say something like, that is supposed to pull back, or she just jerks it back, and he goes to the roof, and the next day asks his friends, what was that about? I wasn't in my life in such pain.
Yeah.
She just pushed it back, and Unfortunately, that's how many men end up in my surgery when they found out it actually. Doctor, would you tell me, is it actually true that my foreskin should go back completely? Oh, of course, yes. Well, nobody told me that, ever. I'm 25 years old. I found it out now the hard way when the girl told me last night and said to me, until you fix that, don't bother me again. You know, there is many connotations from a female point of view, and you need to understand that psyche as well. If they find that the foreskin can't go back and they worry about infections and how clean it is, all that kind of thing, come on, this is something we need to talk about. We need to deal with these things, you know.
The actual procedure itself, I know people are very, very curious. Could you give me a brief description? And you can be as descriptive as you need here, because it's important people understand. But a lot of people don't actually know how a circumcision is done. Are there different ways of doing it for different conditions? You mentioned phimosis and BXO. Are they different procedures? Are there different surgical techniques? Does it differ from surgeon to surgeon or country to country? Or how is this procedure done?
I think there are as many techniques as you would find doctors that do it.
Okay.
There are techniques that are, especially maybe in our situation where we are pressed to do large numbers, we would do 6, 10, 12 circumcisions at a stage.
Okay.
In the practice. So, and you would start early on a Saturday morning, and you don't rush the procedure, but obviously you adapt the procedure to the time that's available. So there are techniques available where you would mark the penis with the foreskin extended over the head of the penis. You would mark behind the penis, pull it back, and mark another, do another surgical mark about a centimeter behind the glans or the corona, and then do a excision, slow, meticulous excision of that piece of tissue, and then obviously followed by the suturing. Or there's a clamp technique. Some of us have developed a bit of a modified clamp technique where you basically take the foreskin, pull it forward, put the clamp on the foreskin, on the line that you've drawn, and take that off, and then decide if you need to take a little bit of extra skin to make sure that your surgical line or scar line ends up in the right space. Obviously, there you can do a circumcision that's less tight and more tight, or you can do a partial circumcision.
Four different ones. And I don't want to go into too much detail there, but people can go and look it up. You know, you have the low and loose, and the low and tight, and the high and loose, and the high and tight. You know, these are things that people can consider.
Traditionally, with us, circumcision is it's seen as a tight. The head of the penis needs to be exposed properly.
Yeah. Okay. Well, in Ireland, like you said, circumcisions are very unpopular. So what do we do with guys coming in and with a phimosis, and they need to have it corrected? Well, the first thing they would say that, Dr. Sam, I want to still have my foreskin. But it's nearly an impossible situation. You say you need a circumcision, which means removing all of the foreskin. So yes, we do a customized partial circumcisions. And if I tell you that 95%, according to my statistics in my practice, I would do a partial circumcision, and just 5% of all the hundreds and thousands of patients I've done over the 13 years would actually be classical. So very few, nearly all of Irish males would request a partial circumcision, which just means that we basically remove just enough of the tip of the foreskin to remove that actually tight band. That means that when they stand up and they flash it, they still actually uncircumcised in appearance. So the foreskin covers still most of the foreskin, of the glans. And unless somebody knew you before, very well, nobody would really know that you had a circumcision, right? Because it's a functional approach we want. We want the glans to be fully exposed during erection. So unless you correct and remove that tight ring, which stops it from rolling back behind the corona, you're stuck with the problem. So a partial circumcision is actually a very good compromise for guys who still want to have a natural appearance, which is very important in Europe and particularly in Ireland, it seems. It's part of the Irish culture, you know. So it is interesting. You can customize it, like Ernu said, you know, so many styles, so many doctors, you know.
Yeah. That's very interesting, because what I find is that most of the patients, when they come to the practice, they come with a picture of what they want. So they've looked at their brother or their friend, and doing a partial or ending up with a partial circumcision would be seen actually as it not being done properly.
As a failed.
Really?
It's a failed circumcision.
Yes.
Okay. And does it provide the same health benefits and the same? I suppose it depends on the condition, really, isn't it?
Yes. Well, the only reason why I do that circumcision in that particular case is because the foreskin failed to function properly. So this is called a dysfunctional penis, by the way.
Yeah.
It's good for peeing, but you can't have intercourse really, because it's like having intercourse with 6 condoms. Your sensitive bits of the corona and the glans is not exposed at all. It's covered by a thick foreskin. So a lot of that leads to males struggling to actually ejaculate when they have intercourse. Take much longer to ejaculate, and especially if they get older and the sensitivity reduced in general, that's usually when I see them in their 40s and their 50s. Just to say, listen, my wife says to me, I better do something or she's not available anymore. But I can't go on for half an hour or 3/4 an hour, and I can still not masturbate eventually to actually ejaculate. I can't ejaculate during intercourse.
And that's one extreme of when the phimosis is very extreme. What we find very often is that the gentlemen have a mild or intermediate type phimosis, but what they do have is that they get recurrent tearing the foreskin. So you can imagine if you have intercourse with broken skin, it's very sensitive afterwards, and your risk for contracting HIV or sexually transmitted diseases with exposed or broken skin is dramatically increased.
Okay.
So in our case, it's a medical treatment. It's a treatment to remove that tight skin that tears all the time. And we find that studies show that you actually get thickening of the mucosa of the glands. So your risk of contracting, it's more like normal skin.
Yeah.
So your risk, and that will bring us to the sensation. Does it really decrease your sensation and decrease your risk of premature ejaculation, which would be something that we'll touch on just now. But for us, it's very important. I think that's why having a tight circumcision done is so important for us, because you can't do a partial, because you still have the glands it's not exposed all the time to the friction in your underpants, so the skin doesn't really change to the way that we would want it to prevent HIV prevention.
Okay. Yeah. So in the African context, I can fully understand why it is encouraged to rather have a classical circumcision, remove all the foreskin for all those reasons that you guys just mentioned there. In the Irish context, with the cultural preference weighing very heavy towards a natural appearance and nobody to see that I actually had a circumcision, it is very important in the design when you do the circumcision, especially when you do a partial circumcision. And this is the important thing, is that partial circumcisions are, from a surgical execution point of view, much more complicated and difficult to do than just a classical circumcision.
I agree.
Yeah, it is difficult. It is, and that's why a lot of doctors do not even offer patients the option. And a lot of my patients would say, I've been to another doctor, and the only circumcision he says he will do is a classical circumcision. I don't want a classical circumcision. I insist keeping my foreskin. So doing a partial circumcision, it's years of experience. My colleagues used to call me Dr. Precursor, because it's a design. So when I take my pen out and start making drawings, I start measuring and getting an idea what circumference are we talking about, an erect glans eventually to fit into that partial circumcision.
Yeah.
You need to do maths, you need to do calculations, you need to do design. It's customized.
I must say, I watched you doing a few in the past few days, and it's quite impressive. There's a lot of finesse and art going into that.
Yeah, and that's why it's avoided, because we can easily end up with phimosis. As it is, when I do a partial circumcision, I have to tell people, the statistics tells us that 3% of them would definitely end up with a phimosis, and they will end up with another circumcision. So there is always that risk. Risks go with us in our job.
Dr. Sam, just out of a matter of interest, maybe for the listeners, I asked you about what is the risk of developing a scar in the surgical line. Can you just give us a little bit of info regarding that?
Yeah. One of the interesting things when we do partial circumcisions or even classical circumcisions is that the healing in the penis is remarkable. It was designed to be injured and to be ready the next day again. So the wound healing of the barrier of the foreskin and even of the shaft is, in comparison with other parts of the body, a very quick healing area. All right. The scar often in some people would make a huge difference in also reducing sensitivity of the area. And we know that the inner foreskin or the mucosa part actually is a very important part of sensation. All right. So a lot of the reasons why I get people to say I want to keep my foreskin is actually to keep that inner foreskin part that makes better sensitivity. All right. But I'm sure, I don't know if you would agree with it, but people would ask me, nearly 9 out of 10 guys would read about circumcision. First thing they would say, if I get a classical circumcision, am I going to lose my sensitivity, or is the scar going to cause me to become so sensitive that I can't enjoy my sexual experience, right? And we actually don't know. There are hundreds of studies conducted to compare your classical circumcision, loss of sensitivity. I can just say from my experience, I've possibly over the last 25 years done thousands possibly by now. And I can't tell you, if people ask me, what do you think? I'm going to say to you, as many people that said, I think I've lost with sensitivity, I have to acknowledge that. So many would have said, my sensitivity improved after my circumcision. I have now better sex than ever in my life before. So I suppose it's very subjective to measure.
That's for sure. And we find that I very often have gentlemen come in and say, but when I was younger, I was able to have 1 or 2 or 3 sessions in the evening. And now it's become so sensitive. Can you please circumcise me so that it's not so sensitive? And this is totally contradictory to what you've said now. And I think you are right. I think it's very subjective. Having a circumcision done to reduce the sensation, to have longer sessions of intercourse or more sessions in the evening. It's a very personal thing.
It is a very personal thing, and this brings us to the whole topic of sensitivity and another huge topic for males, why they knock our doors. That would be premature ejaculation, which by definition is the failure of men to actually go through the normal 5, 10, 15, 20 minutes that a normal intercourse session would last. They usually will ejaculate within the first 3-4 minutes. Even just by entering into the vagina, they might immediately ejaculate. And that's a medical condition. So premature ejaculation is a huge issue for people suffering from that. It is a big problem, right? So there are a number of interesting things that is available, and there's studies that confirms that, well, there might be an improvement by doing a circumcision. That in return causes desensitizing of the
skin of the glands.
Skin of the glands, because it's all the time exposed to the pants and underpants, and it is desensitized, so it's not that reacting. But we need to remember something here, is that the way the sympathetic and the parasympathetic and the sensory neuron development of the glands is actually very interesting. When you get aroused, there is an indication there is a completely different set of nerve ends that starts getting active. And whether you're circumcised or not circumcised, that is, let's call it the fun receptors.
Yeah.
They play nothing to do with whether you're desensitized or sensitized. It's just different receptors. Right, okay. So in general practice, there are now medication. There are drops that you can put into the meatus.
Special condoms with a local anesthetic on the inside.
Exactly. Localized EMLA creams or local. These guys go to great lengths just to get that 1 minute
extra. Even some of the older SSRIs, the antidepressants, we know that one of the side effects of using this medication is a delayed ejaculation or climax.
Okay.
So men would use antidepressants, SSRIs
as a performance
enhancer.
So When you asked me, Nana, about the scar and sensitivity, etc., it actually was coming from a study that was done for premature ejaculation. And this is an article that was in the Scandinavian Journal of Urology, and it was published in 2013, which was definitely an eye-opener for me, because I would typically say to a person coming with premature ejaculation to me, requesting circumcision, I would say to them, I don't know. There's no evidence that support that classical circumcision or partial circumcision make any difference to premature ejaculation. And I would always say to them, this is your decision. But you must remember, these guys are absolutely desperate to get that extra minute to just be normal. All right. So I say to them, this is your risk, as long as I've informed you that you might have absolutely no difference make. All right. Because I can't tell you, there's no study that shows that it becomes desensitized. All right. So this particular paper came out, which was measuring the relationship between circumcision, scar thickness, and the post-circumcision mucosal length, and if that is making any difference in premature ejaculation, right? And the conclusion of the study was very interesting, because it said there was no relationship.
Okay.
In other words, I actually quote this paper now to my patients, say, listen, there's the proof that it actually cannot make any difference. And in the group of people that was actually examined, there was no evidence to justify this procedure. But as I say that, there are also papers that say, yes, there was a small 1%, 2%, or even 0.5. Now, for some people, 0.5. To them, it is a possibility that hopefully they will be part 0.5, and you cannot really discourage that. You know, these guys are desperate.
One thing that we do find is that post-circumcision, especially in men that's had a tight phimosis where the glands of the penis has never been exposed really to the outside world, we do find that after the circumcision, it's extremely sensitive to touch, very sensitive. So it does desensitize a little bit, but like Dr. Sam said, we don't know. There's no real studies that show that doing a circumcision will reduce your sensation, will improve your premature ejaculation.
Okay. Yeah. Okay.
Yeah. A very interesting thing, because I'm doing glans augmentation. Some guys come in and they would say to me, you know what, I have a nice looking shaft, but I really have a small head. And it really bothers me emotionally, psychologically. I always put the light off. I make sure that I have a full erection before the girl sees me. And these things are real for these people. They are absolutely petrified to be seen
as abnormal.
Exactly. Yeah. To be abnormal. So for those people that come in, we actually use hyaluronic acids, which have good evidence to prove that it has enhancement features, and we're going to have a good chat about in our next talk about enhancing the penis appearance, size, and functionality even. But talking about premature ejaculation, one thing that we know about using the hyaluronic acid fillers in the glands is that has a reducing of sensation effect. Now, can you imagine, in many ways, this is now a new field that opened with the technologies that's available now. It's the same type of filler that you put in a lady's lips, right? For lip augmentation, it's the same type of filler. They are usually specially adapted for urology use. And when you inject that all along the glands, the corona, to make that bell flare. That's what we call it. It flares the bell. Think about the church bell on the bottom part of it, which is just flaring out. Now, that's the part that actually scrapes along the vaginal wall. And that's where a lot of these fun receptors are sitting.
These little nerve endings.
That's the little nerve endings. That's giving the sensation during intercourse, right? So when we do the hyaluronic acid fillers in there are now evidence to prove that it does reduce sensitivity. And you need to be very careful when you treat a guy like that and say, you might have a small head, but I just need to tell you, you might lose some sensitivity.
Okay.
Right? That is now a fact. We know I have to tell my patients that. But then you have a guy that says to you, you know what, I have a problem with I can have normal intercourse. But I want to go a little bit longer. I at least want to go at least 10 minutes just to satisfy my partner. I find it very difficult. After 5 to 7 minutes, that's me done.
Yeah.
How can I get that longer? This is a beautiful resolving issue. So we're using, particularly in those patients that doesn't necessarily have premature ejaculation, but you just want to prolong their performance, very efficiently put the filler into the corona, and you can prolong that performance action. Yeah.
Just a couple more practical questions that I know are very, very common before we wrap this one up. Number one, people come into this practice anyway, and they look absolutely terrified. So everyone is worried about the pain of the procedure and the recovery afterwards, because it's obviously a very, very sensitive area. Obviously, you use anesthetics and in some cases general anesthetics, but people are worried when they go home and they're going to have lots and lots and lots of pain. Is that something that people will experience? Pain, and there will be swelling, obviously, but it is a very, very uncomfortable procedure afterwards, and during the procedure as well. But afterwards, most people are concerned they go home and they're left in agony for a few days.
Yeah. Well, I can only talk for my practice, and again, this is something that goes from different practice to practice and clinical experience of the person. Some patients are booked into a hospital with full general anesthetic. Some are just done by local anesthetic, like Ernu explained that, and he can give you a bit of reflection on the patient experience after that. In my clinic, I do use sedation anesthetic as an option for patients.
So you're asleep, not a general anesthetic, but you're asleep. Yeah.
It's like Valium on steroids. Okay. It's a particular drug we use in day clinics like that. That is a very short acting, and you basically sleep deep just for that first 10-15 minutes, and that just means I can do the local anesthetic all around the base, injection of the local anesthetic, completely pain-free. So I also use a long-acting anesthetic that lasts about 8 to 10 hours. So when they wake up, they have absolutely no pain. They go home, absolutely no pain. I have a lot of my patients actually coming in from overseas to have it done, procedures done from Europe, even from the UK. And they actually go to the airport and they fly back, and they might have discomfort the next morning, 3 or 4 o'clock, when that 10, 12 hours are past, In general, if you're careful, and I think the technique is very important, how you execute that. If you use arteries and clamps and all kinds of stuff, the more you injure, the more the pain receptors are triggered. But if you're gentle with your approach to the surgery, people would have very good relief with just a local anesthetic cream, which I discharge my patients with just a local bit of local anesthetic cream. And very seldom do they have to take even paracetamol or a simple painkiller. But it's actually very tolerable.
So relatively pain-free on the whole as a
exactly,
procedure.
Yeah.
You must understand, it's one of the very real risks or concerns to a patient is, am I going to bleed afterwards? Am I going to swell? Is it going to be painful?
Yeah.
So you really need to put a lot of attention, or pay a lot of attention to making sure that when that patient is done with us, it's done under local anesthesia only. We take our time. The patient is pain-free when we start. And if the pain process doesn't start, you end up with a patient in the end which is pain-free post-procedure.
Okay.
So very, very important. We also discharge the patients with analgesia, pain meds post-surgery. But they really don't have any pain post-procedure. It's a little bit uncomfortable. If you are an office worker, you might go to work the next day or the day after. If you are a manual laborer, I would very often give a couple of days of sick leave. Just take it
and
easy.
And depending also the type of procedure, absolutely, I think 2-3 days for most people back to work, if it's especially if an office environment. So in my practice, I know Fridays is a hectic day for circumcisions. We might do 5-6 on a Friday. It's a very popular day to book because you basically have a rest Saturday and Sunday, and you're back in work Monday, losing only one day, or some people just take the day off in general, without actually interrupting the work schedule, But it also depends on the type of procedure. For instance, if you do classical or partial circumcision, I think that's the time we both agree on there. But if you just do a frenuloplasty, which is another big topic, why males come in, and that is where that banjo string actually is so short that it causes severe discomfort, especially during intercourse. So when you do a frenuloplasty, it's a fairly simplistic procedure. You definitely will be back to work the next day.
Okay.
Right. It is the equivalent of you having intercourse and you rip your own frenulum. The procedure is far less painful than that episode, right?
Okay, yeah. And
But
that's
you're
traumatic.
basically back to work the next day, you know.
Okay. Yeah, just on the frenulum there, the frenuloplasty is a slightly different procedure than a normal traditional circumcision. Is that correct?
The frenulum can be done in a few ways. Some people want the frenulum to be removed, right? So
For aesthetic reasons?
for aesthetic reasons, especially when they want a classical circumcision, they don't want that turkey neck. Appearance of a loose piece of skin dangling under the head of the glans. They do want a frenulectomy, so we remove the frame completely because it actually has no function then, you know, in a classical circumcision. But especially if I do a partial circumcision, the reason why you have a frenulum, think about where it attaches on the bottom of the glans. And it is like two little arms running around the whole circumference of the penis and coming back and reattach again at the same spot. So when you pull the skin down on the shaft and you leave it, guess what? It starts to pull up again and cover the head again. That's the frenulum. That's its function. It is an elastic band that literally pulls the foreskin back to keep the glans covered, to keep the gun in the holster, basically. Right. So if you remove that, you have a problem because then you have a flip-flop situation where the foreskin is neither over or below the corona. So when you do a partial circumcision, we always retain the frenulum, but we do then a frenuloplasty, which is basically a plastic surgery procedure, a specialized procedure where we actually elongate the frenulum. We just make it longer. When people come in with a frenulum breve, it is usually less than a half a centimeter. In a normal healthy male, it should be at least 1.2 to 1.5 centimeter in length. Now you can see that's a dysfunctional frenulum. It cannot allow the foreskin ring to actually retract right down the full length of the glans. So it needs to be able to travel that inner foreskin ring right down to behind the corona. And if that frenulum is too short, it keeps the frenulum, the foreskin attached to the tip of the penis, and it just is physically impossible to pull it down.
It also pulls the head of the glands, it actually pulls it down.
So it curves
like a cobra head.
It angulates it, it's like a cobra head, exactly.
And they can be quite uncomfortable. We do see that gentlemen, they actually tear if they have they develop recurrent tearing. And as you understand, once it's torn, there's scar tissue, makes it less elastic, so it tears again, becomes a problem later on.
It becomes a painful scar. And here's the thing. If you have a cobra head, in other words, if you want to know if you have a short frenulum, it's very easy to do. If you have a full erection and you pull the whole shaft skin down to the base of the penis, and you see that the head itself doesn't stay straight, but actually bends down, because this little pulling skin on the bottom, it actually puts it into a cobra head position. The problem there is in the physics. When you have intercourse, when you enter into the vagina wall grips the skin, right? That's the equivalent of you pulling your skin down to the base. And then when you push in, you actually push the penis shaft forward, which is before ejaculation, it's actually bending the head down in a downwards direction. But the curvature of the vagina is an upwards curvature. Right. So it is opposing the direction in which the head goes, and immediately the guy goes into agony mode, into losing the erection, and it is a lot of the time why people come in to have the frenulum fixed is when they actually during intercourse can't complete or lose erections.
So if somebody is experiencing, anyone listening, a bend like that or a shape like that, that's something that you can come in and have checked and potentially have corrected.
It's very easily fixed. Okay. Yeah, it's a small procedure and it can be easy. It makes a huge difference in the quality of life, especially in sexual life quality. Yeah.
And is that something that could worsen over time if somebody has a slightly tight frenulum but has not had any issues to this point? Could that worsen potentially? Or
like I said, if you have a short frenulum, and you get recurrent trauma.
Yeah.
The tissue changes. It becomes a scar.
Okay.
And the tear continues, and obviously it becomes a big issue in terms of performance. If you know that you're going to have discomfort or pain during or after sexual intercourse, the erection might not be as proper as it's supposed to be.
If we look from a dermatology point of view, the foreskin and the lower eyelid shares very common characteristic, and that is having a high level of elastocytes, or cells that produce elastin. So those two skin areas, the lower eyelid and to some extent the upper eyelid, and the foreskin, has the highest amount of elastin, right? Which means the cell can actually expand its own length by 5 times. So when you tear the frenulum and you have now an injury, collagen type 3 kicks in, because the tear went right through the dermis to the deep dermal level, sometimes right through that into the subcutaneous level, and that's when you see bleeding, right? So when it tears right into the deep dermis, collagen 3 starts to form, which is a fibrous tissue. So now my scar is a fibrous tissue scar, which is unstretchable, unforgiving, and not elastic. So when you develop a non-elastic scar in that area, you can imagine next time when you have intercourse, it will just tear next door and next door, because the fibrous scar in our body is designed to absolutely protect.
So it reinforces the area.
It reinforces like concrete in that area. But if you don't repair with elastin in that area, it means can't stretch. And it actually then makes the frenulum breve becomes shorter and shorter. So people in their 20s are fine with the frenulum breve. We don't see them. In the 30s, when they get more sexual active and we get more into long-term relationships, suddenly it's some issue. But I'll tell you, by 40s, when we naturally reduce our elastin production in our body, it becomes a real issue. Okay. Then it literally is a matter of the wife telling him, after the doctor, can I call the doctor? But you have that fixed now, right? Yeah. So that's usually what happens with the frenulum.
Okay, well, look, that conversation's been fantastically educational, and I think it'll do a lot for people to lift the mystery and the taboo surrounding this subject. And one last thing I want to say as well is, while this might be abnormal anatomy, if you want to call it that, this is not an unusual or abnormal problem. There are thousands and thousands of people. Common. Yeah, so it really is. This is not to sound condescending. It's nothing to be ashamed about, because your experience, Dr. Sam, is that people are embarrassed and ashamed when they come in here. So if a resource like this can help people understand first that this is something that can be fixed, it can be helped, it can totally revolutionize and change your life, then we've done a good job.
And it's so interesting when I speak to Ernu. We had good times in theatre this week, sharing knowledge about circumcision, etc. When we had our discussion preparing for this as well, I was amazed by because of the information campaigns that runs in Namibia. And this is a third world area country, and the level of education those young males have and the awareness they have about that is actually astonishing. But here I sit in a first world country, and my patients literally sometimes hear it for the first time. Yeah. That there is very little exposure. It says a lot about male health being extremely neglected. I think females are much more informed, much more exposed, and campaigns running for females to make them aware. Other than vasectomies in this country, I'm not aware really of any male health issue, open discussions or forums or...
It's interesting, as you might have a taxi service promoted above a urinal in a bathroom at a bar. You typically see a VMMC, a voluntary male circumcision poster.
Really, yeah.
Or at the entrance of a shop, or a...
Imagine that on the airport,
No, it wouldn't go down too well. Yeah. But it should. And like you mentioned there, not to exclude the females, we will have future discussions for female health. And we will continue our series on male health as well. But for now, Dr. Sam and Dr. Ernu, thank you very much for your time.
Thank you, Dan.
My pleasure.
And,
thank you, Dan.
We'll chat to you again. If you or someone close to you would like to learn more about male health or anything discussed in this podcast, then you can contact Dr. Sam's Male Health Clinic at info@circumcisiondublinIreland.com or visit the website at www.circumcisiondublinIreland.com. To get in touch with Dr. Ernu de Villiers, you can email him at ernu, E-R-N-U, at afol.com.na or visit his website www.namibia-aesthetics.com. If you want to get in touch with us about the podcast, then you can email us at info@humanregenerationproject.com. If you enjoy the show, you can show us your support by subscribing and following us on YouTube, Facebook and Instagram. Thanks for listening, guys. See you next time.